Hi, we're going to talk today about adnexal masses. I'd like to mention a study with a random sample of 335 asymptomatic women aged 25 to 40. And then the prevalence of an adnexal lesion on ultrasound examination was 7.8%. Now just remember that prevalence is the total number of existing cases of disease in a population at one point in time. It is expressed as a proportion of the total number of persons in that population. Now when we see a patient with an adnexal lesion, we just need to think, does the patient have an acute condition such as ectopic pregnancy where the person usually goes to emergency room because it has a terrible, severe pain that cannot tolerate anymore. Now we also need to determine whether the mass is a malignancy or not, because malignancy can give you pain or not when we talk about ovarian cancer. So we need to look for the etiology of the mass. This process is often difficult since there are many types of masses, and surgery is often required for getting a definitive diagnosis. Now we need to consider first, where is the mass located? Is it in the ovaries? Is it in the fallopian tube? Where is it located? And the age of the patient is very important, because if we talk about a postmenopausal woman that has a solid ovarian mass that is irregular, not looking very good, it is highly suspicious of ovarian cancer. On the other hand, if we see a woman of reproductive age that complains of pain and bleeding, vaginal bleeding, we need to rule out a pregnancy. We need to rule out an ectopic pregnancy. These are just ultrasound images to show you how it looks a tumor, an ovarian tumor. You can see the blood flow. We can see ascites, and it's usually in postmenopausal women. Now, on the other hand, you can see the other image where there is an intrauterine gestation, but you can see an ectopic gestation as well, located in the fallopian tube. So just to review, we need to look for, to see if it is an urgency. The patient is talking to us. We need to find out if it is an urgency, such as ovarian torsion, which you can see the image on the left. Or we need to see if it is a malignancy, just where the patient usually complains of discomfort because of the size of the lesion. But it can also show severe pain with time. Now, what are the differential diagnoses of an ovarian mass? We talk about physiologic cysts. Now, physiologic cysts are very common in reproductive age women because usually comes and goes. Like you can see it, and then you can see that it disappears after the next menstrual period. Now we can also see benign ovarian neoplasms such as endometriomas or mature teratomas or dermoid cysts. Now, when we're talking about the location, we talk about the ovaries. Now we're going to talk about the fallopian tube. Now, what could a mass in the fallopian tube be? So it could be an ectopic pregnancy, or it can be hydrosalpinx or fallopian tube cancer. Just remember that hydrosalpinx usually is usually related to a sexually transmitted infection, but it is not the only cause. Now, what could be the cause of an adnexal mass that comes from the tissue that surrounds the ovary and the fallopian tubes? So we're thinking about peritubal or periovarian cyst. We can think about a tubovarian abscess, or we can think about a leiomyoma. Now in the image, you can see an ultrasound that shows hydrosalpinx in a 75-year-old female, postmenopausal, that complain of bleeding, vaginal bleeding. The patient's age and the reproductive status is very important as well. Now, if we talk about children and adolescents, it is very rare to find an adnexal mass at that age. But if it is present, we need to be aware that 10 to 20% of the cases are related to malignancies. Now, if we talk about premenopausal women, the majority of the adnexal masses occur at this age. Just remember what we said about physiologic cysts. Now, however, they are usually benign, and they are associated with menstrual cycle, as we said, or reproductive hormones. So we're talking about follicular cysts, and we're talking about endometriomas. Just remember, endometriomas, you can find them in any part, say in the fallopian tubes, in the ovaries, or even in the pelvis, and it is a piece of tissue that contains glands. So at every time that a woman has the menses, it tends to hurt a lot. It tends to cause dysmenorrhea. In pregnant women, we need to look for ectopic pregnancies and luteomas. We also need to look for corpus luteum cysts. And it is important because those persist longer during pregnancy, and they can reach a big size and become hemorrhagic. They can rupture, and that rupture is usually very painful. Or they can go to torsion, and that's very painful too. Now, we can also think about fecal lutein cysts. Now, in postmenopausal women, we already said that our goal is to exclude malignancy, because that's a big risk for postmenopausal women with an adnexal mass. Now, the average age of diagnosis of ovarian cancer in the United States is 63 years old. Now, we're going to talk about the symptoms and the history taken from the patient. We know that the patient usually complains of pain, okay? It's very important to ask, when did it start? Where does it hurt? For how long? Is it constant? And we need to ask if it is associated with any other factors like the menstrual cycle. Now, an adnexal mass that is associated with severe pain and it is of abrupt onset, or pelvic pain in a pregnant woman, we need to think that it requires immediate evaluation. So we need to order pelvic ultrasound. Now, ovarian physiologic cysts or neoplasms are typically associated with a dull, achy pain that usually localized to the site of the mass, or maybe just asymptomatic, as we mentioned. And endometrioma can present with dysmenorrhea or dyspareunia, and is usually a woman, childbearing age, that complains of severe pain with menses. The patient presents with vaginal bleeding and with pain. Just remember, we need to look for ectopic pregnancy. So we need to request a pregnancy test. Now, if you see that the patient is in pain, severe pain, and when you examine the patient is febrile and has a vaginal discharge, just think about abscess, okay? We need to rule out abscess. We need to order an ultrasound. We already talked about symptoms. Now for ovarian cancer, just to remember, we're going to repeat some of them, okay? So usually the woman complains of feeling full after eating, even a small amounts of food. They complain of abdominal or pelvic pain. They can or cannot. Now you see that they also say that they're having a lot of bloating lately. And you see that they need to urinate very often. During the physical examination, we can see the distension of the patient and that the patient is complaining of pain. Now, when we do a physical exam and we do a pelvic exam, we can, if we do a bimanual exam, we can usually feel a pelvic mass. And then we go up to the abdomen to feel the abdomen, to palpate the abdomen. And we may be able to feel a mass or fluid within the abdomen. Now, if we suspect malignancy because we felt something that is not right, we need to think about the places that could give you metastasis to the ovaries. We're talking about stomach, which is the most common. We need to think about colorectal, and we need to think about breast. Also, we need to think about potential places of metastasis from a primary ovarian malignancy, which are the nearby ones, which are the rectum, but then it can go through the blood and it can spread to the liver, spleen, lungs, inguinal or supraclavicular lymph nodes that we can actually see. Now, imaging. We talk a lot about pelvic and transvaginal ultrasound. Usually transvaginal ultrasound is better to identify ovarian masses because the visibility is usually better and the patient doesn't need to have a full bladder. We can also do request an abdominal ultrasound when we think that we palpated something that we should not. Now, also MRI imaging should be used as a second imaging study if further imaging is needed to decide whether to proceed with surgical evaluation or not. Here there is an example of ovarian cancer and peritoneal metastasis. Talking about laboratory, just remember about the white blood cell count and complete blood cell count. We need to do that if we suspect anemia. Anemia is usually due to bleeding, say because of an ectopic pregnancy or because of rupture or hemorrhagic ovarian cyst. And we also need to look for leukocytosis, which is elevated white blood cell count in cases of infection. Now, also remember pregnancy test. If you see that there is a woman of reproductive age who presents with an adnexal mass, we need to rule out a pregnancy. Usually ectopic pregnancy, because that's the one that gives a lot of pain at certain gestational age. Now, we can also request CA-125 only if the ultrasound appearance of a mass makes you think about malignancy. Okay, that's the end of our presentation. I want to thank you so much for watching.
And don't forget to subscribe for more videos like this. Thank you.